As a paramedic, seeing the impact that heart disease is having on the people of West Virginia, it's overwhelming our EMS system. Here in Marion County, heart disease, chest pain, shortness of breath related to heart disease has become the #1 call for help. And so we see every day that our crews are out in the field trying to take care of these patients. And what we're trying to stress to those patients is how important it is to notify your EMS, to call 911 on the onset of symptoms. Don't delay care, because that only makes the situation worse.
Recognition of signs and symptoms are very important. Knowing the signs and symptoms, the difference between male and females is very important. A male might have your typical chest pain, meaning the center of your chest might go down to your left arm, where a female will have different symptoms. They might have some stomach pain, some back pain, nausea feeling. They might not think of that as a cardiac event. So just knowing that that can be a sign and symptom of a heart attack, getting the public to realize that and to be able to call 911 as soon as they realize that is a huge, huge thing to be able to recognize that and get help.
Stroke is one of the leading causes of disability and death, not only in West Virginia, but across Appalachia and across the United States. And it's so important for people to understand the signs and symptoms of those having a stroke, whether it be one-sided weakness to the body, whether it be difficulty speaking, a severe headache. It's important when you experience those signs and symptoms to call 911 to get to a stroke-ready facility that can do a surgical procedure or be able to give life-saving medications, and that is so time-sensitive. It's so vitally important that once you start experiencing the signs and symptoms with stroke, to activate the 911 system so that our EMS professionals can get you to a stroke-ready hospital in the amount of time necessary so that we can help you and that hospital can help you.
Being your own advocate is very important, and what we try and tell patients that if something is off, if they don't feel right, to definitely call 911. They're not being a bother. That's what we see a lot of times when we go to patients' houses. They're like, "I'm sorry to bother you," or "I'm, taking you away from another person that needs help. I really don't need that much help. I'm so sorry." They apologize a lot. I always tell patients, you called me for a reason. Something is off that day. You picked up something that is different from your normal daily, feelings of what your body goes through. Let's go get checked out. If it's nothing, great, it's nothing. But if it is something, you're catching it early.
Knowing that West Virginia is in one of the top 5 states for heart disease and stroke, we have to remember that these are preventable diseases. We need to make sure that we're paying visits to our doctor, we need to make sure that we're exercising more, that we're watching our diet, and that we're preventing ourselves from doing things such as smoking and drinking and items that are contributors to heart disease and stroke. But we also have to remember that if we have the signs and symptoms of these diseases, then we need to contact 911 and get to your local hospital. You're not a bother to call for help. That's what we're here for.